Happy first day of spring. My name is Andrea from Toronto Event Hub. We are going to do our live on chiropractic tips for women. We are here to celebrate Women's Month. As you know, we've been doing a number of online as well as in-person events to celebrate and support women because March is Women's Month. So I'm so excited for today's topic at lunchtime. We always like to do some educational topics, and I have Dr. Joyce Fu from Fu Chiropractic, who will talk to us about women's health and specifically chiropractic tips for women's health. So as you tune in, I'd love for you to join us, and if you have any questions or comments, feel free to put them in the chat. And it's going to be a half hour of tips. So I'm just going to invite Dr. Joyce Fu, and I'm so excited to invite her back. And Joyce is not only a chiropractor, she's also a dancer, a yoga instructor. She does everything. So hey Joyce, I'm so excited to have you on today.
Hi Andrea, how are you doing?
Great. Happy first day of spring.
Yeah. Great day to do this.
Yes, amazing. So thanks. It's a Monday, so it's great for Monday motivation as well as, we're here to celebrate and support women. So, speaking of women's health, tell us more about how you can help women through your practice and your services for women.
Absolutely. So, first and foremost, obviously I'm a woman. So I've gone through my own process of trying to heal and understand my body. So with those tools and my understanding from dance, from yoga, from all these other types of training, I'm able to really tune into what women need in terms of the layers of complexity, understanding where they're coming from rather than just what the diagnosis is. Usually there's a lot more complexities around like, what does this actually mean for me, and how can I prevent this in the future, things like that that don't usually get addressed in our medical care right now. And I want to address those things with the best evidence-based and from my personal understanding of what is best out there.
And, when we talk about taking care of our health and, the terms like self-care, self-love gets thrown around a lot.
Yeah.
And I want to quickly talk about, why we should focus on women's health, and specifically maybe even for you to go over, because I'm sure a lot of people in the audience, probably most of them don't see a chiropractor, whether they're scared, it's about like cracking bones and they're scared of that. People go for massages or to, go get physio, but maybe tell us a bit more about chiropractors as well as why we should focus on women's health.
Sure. So chiropractors are trained healthcare professionals that are able to diagnose, to treat, and assess any issue in your physical body. So we could be equivalent to a physiotherapist, but we actually have more rights in that we can diagnose. We can give you a formal diagnosis, and we can give you any referral if you need imaging, so x-rays, MRI, things like that. We can also communicate to your medical doctors as well, because we have that language. We're able to communicate that stuff. In terms of, why women's health and why is it important in chiropractic is because there's so many changes that happen to women's body throughout her lifetime, from say her teenage years up until when she's aging. There's so many changes that occur that could be helped so tremendously well with chiropractic. A lot of things we do are preventative healthcare things, so they're not even just to treat the issue when it comes up, but it's like if it were to come up 10 years later, your mom might have something that you might have, bunions, knee pain, shoulder pain, chronic neck pain, things like that are very much rooted in our upbringing. And those are things that I like to address. And really obviously as well, women get pregnant, right? And so pregnancy, lots of changes. You literally have a different body for 9 months, and then you have to zip back up into your normal body. Doesn't really happen. We like to believe that it happens because it happens to celebrities, but in real life, it's very different and it's scary. And to have more support, more community around that understanding is super important for healing.
Yeah, knowledge is key, and knowledge is power, and
Yeah.
like that preventative measures.
Yeah.
And most people, not just women, we only see a professional, we only get help when we're literally like in a lot of pain
Yeah.
and like when it may be even too late.
Hmm.
And so with that, what are some of the most common
Hmm.
things that you've seen, whether like for women in terms of that could have been prevented or, really chiropractic care can really help?
Hmm. Like specific conditions, it would be the most common thing I see is actually a lot of hip and knee pain.
Mm,
So women, we carry our weight mostly in our lower part of our body. And this is a part that gets neglected because we sit quite a lot nowadays, driving, watching TV,
working.
computer, working from home, exactly, all sitting, right? And so I see it in the younger population, but also in my aging population, where they are now, you know, having issues walking, just simply walking, taking care of themselves, going to the washroom, things like that that are simple, which could definitely be avoided with more exercise, with the right guidance on what exercises to do, how frequently, how to change your position while working from home, things like that, that all add up into the bigger picture of trying to avoid hip osteoarthritis or hip replacement, knee replacement. All those things are not the end of the path for me that I would like. And I want to change that story for a lot of people.
You mentioned about pregnancy, and actually you treat babies, and I've seen like videos of that. So maybe tell us more about how you treat and help pregnant women and babies.
Yeah, for sure. I love treating my babies. They're so cute. They're the cutest patients. So yeah, babies actually experience a lot of trauma in the womb, but also while in the process of labor. So it's a scary, traumatic experience where they're coming from this warm, dark environment into a really noisy, bright place, lots of sound, lots of distractions, lots of stimulation.
Mhm.
And so that's why they're crying when they come out, right? They're not like, yay, I'm so excited. So with that comes a lot of like physical trauma as well. So depending on how they've been delivered, so with forceps or vacuums, those things are more aggressive because the baby's having issues coming out of the area. And so the doctor will have to go in and literally kind of yank the baby out. And so yanking it will actually pull its shoulder out one side more, and the other one kind of gets caught. And what I see is babies having torticollis. So they actually turn their head to one side all the time. And so that limits their neck range of motion. It affects their mobility to look up and look for breast milk. It affects their tongue and their jaw. Everything here is all muscles and bones that are forming. So for them, I also see sometimes flattening of the head in front and the back because of the pressure. If the mom has scoliosis, their head is always on one side of the pelvis. It affects how their head is actually growing. So I can help with that too. I can help with how they're learning to flip, to turn, to walk, things like that that seem really easy, but babies aren't grown knowing how to do that stuff right off the bat. To show them, sometimes they need more rehab. They need more exercises, you just massaging this area and things like that really help actually.
Wow. Didn't
Yeah.
know. I mean, when you say it, it all makes sense, but it's like never thought like, wow, babies need all this help and that can be done through a chiropractor. So that's amazing to
Yeah.
hear.
Yeah.
And how soon should people like literally, because like they're so tiny and fragile, like how
Totally.
soon should someone really be getting their babies treated
Yes.
and for how long,
So, I've seen a baby as young as 4 weeks, to be honest.
Wow.
Yeah, so it really depends on the severity of what, like, the condition that's happening. So what usually happens is the mom, the parents will bring the baby to a lactation consultant. Lactation consultant will say, okay, the baby's not latching well onto the breast tissue. Let me try to give you some tips, tricks to help it. If it's still not improving, let's bring it to a manual therapist like myself to get it also assessed, and then we would check for tongue ties. We would check for other things that's actually causing more the issue. And if that's the case, sometimes get a tongue tie release through a dentist or a surgeon. And then we help manage it just like any other surgery. So like rehab, post-surgery. Yeah, so it can be as young as 4 years. I've also seen babies like later on, a year and a half, and I can help them too. Yeah.
So tell us more about how you can help women specifically, and like how you treat them, like what's a service like, and what's a session like.
Right. Well, it's pretty general across both sexes, I would say. When I first meet you, just having a conversation, talking about what's going on. What's your perception of chiropractic? Have you tried it before? Because what I usually find is previously they may have a negative experience or something that wasn't, it didn't feel right for them. And so I talk to them about it. Be like, what did they do? What didn't you like? You know, just to understand a bit more what the patient needs in terms of what more can I show them? How can I help them understand their body better? And so with those questions, then we go into a physical exam. I'll check their posture, the height of their shoulders, height of the pelvis, if their neck is leaning forward or back, or their shoulders rounded or back, all those things, which nowadays we're seeing a lot of that, turtle kind of punch posture. And then we move into the formal diagnosis. I talk about our treatment plan, how often you should be coming in, what are some other things they can modify, so stay at their desk workstation, or how often they should be working out, what types of exercises, what types of activities, all those things. And then we try a little bit of treatment, get them used to manual therapy. It's a different type of therapy. It's not, acupuncture is just the needles, but I do that as well. But I mainly use my hands just to get them acquainted with physical touch. And then we wrap it up, and that's usually the first treatment. That's why it's so long.
Yeah, it's very thorough, and you're great at that. And I love that you are able to do acupuncture as well, so you have a broad range of it. So for people watching again, and sorry to put you on the spot, it's like, how is a chiropractor different from a massage therapist and physiotherapist? Because I know there are certain elements, like because certain that you do is like physio with the exercises or stretches, and for some people it's like a massage, and I know I could be saying it wrong, but for some people out there, they're like, oh, I already go get massages and I already do physio, so why do I need a chiropractor, or do I need all three?
Totally. So think of it as like a team of people that's supporting your health, and each person kind of has a slightly different perspective and focus to help you feel better. And so massage therapists mainly focus on the muscles, like skeletal muscles. Skeletal meaning they're not internal, not even like your digestive tract, none of that. It's on the outside, right? Skeleton. And then for physios, again, they're very similar to chiros, where we can treat conditions or diseases of the body. It's just that they tend to have a bigger focus on rehab, so exercises or doing exercise or giving you exercises. Chiropractors are well equipped to do that as well. We just have additional specific training in adjustment, so that is, certain gestures where we might release pressure in your spine. We have a thorough training in that versus physios. I know they can also do some of that, or some physios can do it. And we also have a bit more specialization. So say like you want sports, you can see a sports chiro, baby chiro, pediatric chiro, pregnancy. There's also certain techniques that are more geared towards, say, like the pregnant population that chiropractors can use, such as the Webster technique. So it's when the baby is flipped the other way. So the head is actually on top underneath the ribs rather than below. And we can use the technique to help adjust a round ligament, which is a structure in the front of your body, to help flip the baby around. So there's a lot of differences, but basically we all help you in a slightly different way that overlaps for sure, to overall improve your health, mental health, and physical well-being.
And for those who have benefits, use them, right? If you have the whole so that's always great. So I'm sure this is a question people have, especially for women, as we age, because we don't want to admit it. But how can you help us women like age better? Or what can we do? What are some things that we can do, whether like on our own or through with a chiropractor?
Yeah, there's so many things we can do. The first thing I would say is to do something physical that you love. Um, Something that you truly enjoy, whether it's dance or yoga or swimming or tennis or going for walks, like any of those things, I would just say start doing it right now. Doing it at a frequency that you're comfortable with. So, once a week, twice a week, whatever that is, but literally doing something that you're happy doing, it releases endorphins in your brain and actually helps manage stress. So stress anxiety is like the ultimate disease that I'm seeing in my patients. Everyone's grinding their teeth, everyone's clenching their jaw, and there's all this tension up here, and it's not healthy long term because it causes many problems. Causes adrenal fatigue, causes issues clicking in your jaw, chronic headache, neck pain. The list goes on. So if you can find those moments of enjoyment is in your physical body, it will do wonders. Yeah, that's the main one that I love. The other one, of course, I mean, eating healthy, eating a balanced diet, drinking enough fluids, drinking enough water. Coffee is not water. So like drinking water is good. And also like keeping in touch with your friends and family, and ideally doing something you both love together or have some type of enjoyment together is good too.
I love that reminder about doing something that you love. And do you ever get people who are like, oh, I'm too old, or I have all these injuries or chronic pain, and so I can't go hiking and I can't dance? And I honestly think sometimes it's more of a mental thing. But for those who really do have certain ailments and pains, and obviously they can get treated, but what do you often do when you hear that or experience that with your clients?
For sure. I would ask them to be realistic about their expectations. Like, sure, maybe you can't hike like, the 200-kilometer loop that you usually do, but can we modify it? Can you do like 50? Can you work to get to that 50? Can you, just do other exercises that help with hiking, right?
Mm-hmm.
Like balance training, gait, like training your walking, literally, footwork. There's all these other things you can, again, build slowly to get to that goal. I think we're in the society, we're very geared towards the results. Like, I just want that. I want the magic.
Immediate results, right? Like, I want it like tomorrow.
There you go.
Yeah.
There you go. That's why I'm here to see you, And I'm like, I get it. But you have to understand our body needs time. Your brain is already there. Your body needs the time. You need to give your body that learning curve and enjoy the journey while you're getting there. Might as well. And I also sometimes would suggest other types of exercise that they can try if, say, they can't do that hike that they love to do. I highly recommend swimming a lot. There's a lot of benefits to swimming against resistance. It's actually a pushing type of exercise for your body, whereas many things like weightlifting are pulling inwards. And so if you push against something, you actually will lengthen the body, so you'll stretch it while strengthening at the same time. So there's that benefit too.
So much knowledge. And for people who are like, the immediate results and either laziness or I don't have enough time, and I'm guilty of saying those things, how often and for how long should someone see a chiropractor? Right. Because obviously it's not one and done, like I see you for like that one time I have pain and expect it to like go away and like be, I'm done, like I'm good.
Right. I mean, some people do that. They come in for treatment plan. They're good. They're like, okay, bye. I'm like, okay, bye. For other people who would like to continue optimizing their health, so meaning you don't need to come in just when you have pain, but you can prevent flare-ups, prevent, things happening before they even occur. That we call it maintenance care. So maintenance care is just, once in a while we check in. Is your body moving? Are you still dancing, Andrea? Are you still hiking? How are the hikes? How is your knee doing? Is it doing well? Great, fantastic. Let's keep strengthening it. Let's keep adding exercises to make it even better. Oh, are you changing your work again? Is there some stress? Always checking in, because life is up and down. And so the care can be, at your highest and at the lowest. It also varies between that. And so I know there's a lot of resistance against people being like, oh, I don't want to see my chiro for life. But also, we could help you for the rest of your life too, which is pretty powerful, I think. You can also go the other route, right? There is conventional medical care too, and you can take the medications for 20 years and see how that is. But for me, I'd rather try something natural that makes sense for my body for 20 years too.
Yeah. And having seen you gone for treatments, I love you honestly have, and chiropractors have such a range of knowledge, and the treatment, honestly it kind of feels like I'm going for massage physio and the chiropractor and you can do acupuncture. So if you haven't tried it or you haven't gone with Joyce, you really need to, because it's really this is good bang for my buck. I literally get everything. You're so knowledgeable, even what I even learned even more of and the fact that you know about babies and sports and and just it's so wide ranging. So I really do feel like chiropractors have a very vast knowledge that can really help both genders, but just anyone in all ages. And if you have to literally go, and especially if you have benefits, what are you waiting for? But
you just need to go to the website, book.
Book now, exactly. Before I take the last part to really, actually get you to do a demo and let's do some stretches, is there anything else you want to add specifically about for women tips or women's health before we get into that last part?
Women's health. Oh, yeah, I do have a really, really big take-home point, and it's prioritizing our health is okay.
Yes.
I feel like we often do things for others or do other things before our health, and whether or not that is, as easy as, oh, I should probably take a bath tonight. Oh, no, I don't want to take a bath. I got to answer 20 emails first. Or for me, it's oh, maybe I can squeeze in 2 or 3 more patients. No, I should take the night off and do yoga. I really should. And wherever that energy you give, you can't get back, right? And so it's trying to invest in your health is very, very important. It'll make you happier. It'll make you more present. It'll make you less stressed. It'll balance out your life better in the long run. So I think prioritizing women's health is okay. I think that's a really big key message I wanted to share.
So true. I'm so guilty of it. Literally, I'm I'm gonna, eat my lunch later, and I need to do so many emails, and I should be sleeping. Yeah. But I actually have a coffee right now, and I'm but I'm gonna take care of all these other things. Not just women, but we're all, so many of us are people pleasers, as well as
exactly.
We have so many things to take care of, but we go last, and that's how that's how we get sick. Literally, I am I'm sick right now, and it's because I was just putting everyone else first but me, and so I'm so guilty of it. So people watching, you need to not do what I'm doing, and this is why we have these reminders and these talks. I'm definitely not going to be sitting here and be oh yeah, I'm all that. No. I'm definitely guilty of it. And so we need to prioritize our health. This is why we have these educational sessions to remind people. I don't know, that's so
good. Guilt trip you at all, Andrea. I
know. No. It's just honestly a good reminder. Right? That's why I plant these in here.
Exactly.
But if you are doing that too, I'll obviously comment or show some heart emojis. But okay, so I really wanted to get to, I'm sure many viewers are also like this too, whether we work from home or we sit all day in the car or whatever. And so I definitely know I have tense neck and shoulder muscles. And I'm probably so guilty what you're saying. Like the other day, like you're slouching, and I'm like, no, I'm not. I feel like I'm sitting up. And I'm like, no, you're like hunched. And it's probably because we're so set on this is probably what we look like most of the day, is like we're on our cell phones, we're on our computer, so we're like literally like always in this position.
Yep.
So, and if anyone's like me where I am not in tune with my body because I don't check in. So like I remember when we go to our sessions and it's like, Andrea, like, where do you feel pain? And on a scale of 1 to 10, how does that feel? Is it a pinch? Is it a sharp pain? And I'm like, I have no idea because I'm that out of tune. And again, if you're watching or anything like this, you need to see a professional like right away because we shouldn't be that out of sync with our body.
Correct.
Body. How do you feel the pain? And again, it's like way too late. So anyways, I want to focus on this last bit about like, please help us. What kind of stretches, what kind of things can we do that we can easily do while we're watching TV or maybe while we're working? And so if you can't make the excuse, I don't have time to do this.
Yeah, I like it. I don't have time, but let's make time. Okay, yeah. So easy stretches, like from sitting, is mostly like neck and shoulder area, I would say. So you find yourself like this, and you're probably slowly becoming a turtle, right? So the easiest thing you could do is like have your hands behind your back, interlink your fingers. Yeah, I'm gonna do it behind my chair, and you're just gonna pull your shoulders back, trying to squeeze your scapula together.
That feels good.
Yeah, if you already feel your shoulders just being like crying, then that's a sign they're crazy tight. And try to lift your chest up to the ceiling too. Exactly. And then take a deep breath in and out. Nice. And slowly release the hand. Right? Easy one. Arms behind the back. Just squeeze. Take a moment to breathe and exhale out. That's like literally it. That's one exercise already. Another one, you can bring your hand on the side of your chair and you're going to lean away from it with your head.
Oh, that's
nice. Ooh. So you should feel the tension from like your neck all the way down to the top of your shoulder. And that's your upper trap muscle that everyone's just like, why is this always so tight? I know, I get it.
Is this the same exercise as, when you're stretching, like the whether you do this? Is it the same or it's just better when you like kind of anchor yourself with the arm?
It is the same idea. It's just like I like the pressure of having the chair there, so you get a deeper, further stretch away.
You feel it, yeah.
You can add the hand to feel it a bit more in the neck, right?
Mm-hmm.
Yeah, and then slowly come back up. So I would.
I like this. You could do it when you're sitting, if you're ultimate lazy but still want to stretch.
Exactly. And do the other side. So hand on the other side. Stretch. Take a deep breath in. And out.
Oh, that's another thing. People forget to breathe. I forget to breathe when I do these exercises. Like holding your breath in.
Exactly. And they're like, I think I'm breathing. And I'm like, no, you're not. Oh, no. Another easy one is for muscles in the front of the neck. You're actually going to look up towards the ceiling. So like bringing your chin up to the ceiling. Nice. Do you feel that stretch in the front of your neck, Andrea?
To like, I wouldn't even know to like, or like think about doing this. We're so like, we always do the side stretches, but not like this like. So what is this?
Yeah, but also we're looking down a lot, right? So like we never look up, so the muscles here get tight too, right? Exactly. And then slowly bring your chin down to your chest, and take a deep breath in. You should feel all that pressure in the back of your neck now. Yeah, and then come back to center. How long did that take? Like 2 seconds?
Yeah.
Right? And how do you feel? Probably a lot better already.
Yeah.
Right.
And so you repeat those, like how many repetitions should you do or something?
Yeah, I would do it at least like 3 times, just as slow as we did, not like crazy fast. Slower is better. Breathing is better. The more breathing you do, the better. It's also better if you get up, stand up, and go for a walk too. It's like moving the lower body, the back, the hips, all that stuff too. That's, I would say 3 times, and you can do that like almost every hour, right? Because you're going to go back to this position and everything's going to get tight again.
It's definitely, like, those are super easy and fast. Like, you can like if you're ever in like a half-hour meeting, an hour meeting, and you're not doing the talking and presenting, and you're off camera, you should definitely like be doing that. So,
Yeah, exactly.
well, awesome. This is good. And again, this is just a little sneak preview. So if you want more, you have to book a session. So tell us about that. How do people get in touch with you? How do they book? Are they like, do you do like, I don't know, consultations? Tell us about that.
Absolutely. So, well, I mean, the easiest thing is if you get in touch with me through my Instagram, Joyce Fu Chiropractic, then you can message me if you have any, like, you know, burning direct questions that you're like, I don't know who to ask. You can just ask me. I also offer virtual and in-person 15-minute consultations, you know, just touching base to meet you, to see what you're looking for, what type of care. Maybe massage is better, maybe, you know, physio. I will help you in that process. And then, or you can also look out and see if I'm going to teach any yoga anytime soon.
Are you
Hopefully.
teaching
I
soon?
hope so.
Yeah.
We'll see. We'll see. But I also have a YouTube channel if you ever want to check that out. And I have all my exercise videos that are like 3 to 5 minutes long that you can literally follow along, do it with me, tell me how you're doing, you know, write a little comment, email me. I love feedback. So that is resources for you guys to use. I'm going to hopefully expand on that as well. So yeah, there's tons of ways. My email, my Instagram, my YouTube. I have a Facebook page as well. So that's all out there for you. Hopefully it's all in the link in my IG profile, so you can check it out there.
And where are you based for those? Because I think you do Scarborough and downtown, and I know you do virtual, but for those who are looking to come in.
Yeah, exactly. So yeah, Scarborough, I'm working in a clinic at around Midland and McNichol, and then the other one's in Yorkville, so downtown.
So good. You're out of both cities, so that's good. Well, this was awesome. So I hope this was super helpful for those who are watching. And, you know, try those stretches. And if you have babies, like, again, such a huge thing. Like, I didn't even know babies, like, could get chiropractic care and how much you can help with that. So that's amazing.
Yeah.
And thank you so much, Joyce, for joining in today and educating us. And this is me trying to stifle a cough. And, for those tuning in, again, we're celebrating Women's Month. That's why we have this educational IG Live. But we have 8 more events, and we have 2 weeks left, and it's crazy. So if you're looking to do more education, we have marketing tips tomorrow on how to sign clients organically, 5 simple steps, and we have some in-person networking events coming up. So again, everything is on TorontoEventHub.com for more details. But thank you so much again, Joyce, for this really, really, really helpful chat and really good reminder to take care of yourself.
Yeah.
So thank you so much, and I'm sure I'll be seeing you soon. I got to book a session.
Sounds good.
Yeah. Thank you so much.
Thank you so much. This was so nice.
Yeah, thank you.
You have a great rest of the day.
Thank you. Bye.